I recently had an opportunity to take a walk in the park when I was in Littleton, Colorado, with my friend Deahna Visscher. Deahna and I met through the Patient Safety Movement Foundation a couple of years ago in London, actually, I think it was.
It was.
Unfortunately, yeah, it was good to meet you and your husband. And unfortunately, we are coming together because you have lost a child, Grant, at a very, I think he lived to be how many days old, Deahna?
11 days old.
11 days old. And due to medical errors, Deahna and her family lost the precious son, Grant. And I'm thinking that you'll probably give us a little bit more information about that. Deahna is also a parent partner for an organization called Novel Project, and they're looking for standard of care for feeding tube placement, which is how Grant died after 11 days in the hospital just after birth. Deahna, thank you for taking the time to be with me today to just meet people where we have good audio and we're not walking around the park. But I am also, after you do a brief introduction, I'm going to roll some of those interview questions because I know people will really want to hear what you had to say that day. We actually had quite a long walk and covered a lot of important topics. So Deahna, thank you for taking the time.
We covered a lot of, yeah, we covered a lot of ground that day.
You did. You did.
Literally and figuratively.
Thank you. I was tracking because, as many people know, I have pledged, and I have people who have pledged me with charity miles. And I think we walked about 3 miles that day just before I left Colorado to come to Oklahoma, which is where I am today. Deahna, would you just give us a little bit of context about what happened for Grant and why you're so motivated to attend to the safe delivery of medical care?
Sure. So in 2008, I had my son Grant, and we knew when he was being born that he would be born with a heart defect. So he was immediately delivered 12 hours after birth from one hospital to another, where he would receive the care that he needed to address his heart defect. And he thrived through his open heart surgery. He was thriving through all the different recoveries and little setbacks. Like one day his pulse ox was fluctuating, and he ended up, they discovered one of his lungs had collapsed, and they put him on a CPAP machine and rectified that issue. And then it was a couple of days before he was scheduled to be released home with us that a nurse was not comfortable with the feeding tube that he currently had that had been placed under x-ray because they had struggled with his anatomy to get it in. And remember, it was a Saturday morning, and the nurse that came in had told us that she wanted to try a different style of feeding tube. The one he had currently was for his acid reflux, and so it's called transpyloric, where they insert it past the stomach so that any acid reflux would fall back into the stomach and not come up his esophagus and irritate him. So she put in the second feeding tube alongside his existing one, and she proceeded to struggle putting it in. Told her about the previous day's struggles that they had encountered, and that they had actually done it under x-ray. And that's when the nurse told me that she had been doing this for a while, and that she was very experienced with doing this procedure by the bedside. I asked her, how did she know she would be placing it correctly? And that's when she told me that, their practice at that time was to do auscultation, and that's where they put a burst of air in the NG tube and listen through a stethoscope for it to make a pop sound. And then she said, and I asked her, I said, well, couldn't it make that sound anywhere in your body? And she said, well, that's why we do aspirate. And aspirate is where they pull some fluid up the NG tube. And she said, if there's fluid in there, it means it came from the stomach. And I again asked, I said, well, aren't we mostly made of water? So couldn't that be from elsewhere in the body? I had no idea that the questions I was asking would foreshadow the events that led to his death, because she did indeed put it in the wrong place. It went in, it pierced his trach and fed into his lung, which I later learned that there are two resonant organs in the body that are both the lung and the stomach. and that when she pulled the aspirate up, she never tested it with a pH strip. I later learned that if she had used a 1-cent pH strip, Grant would probably be here today because the acidity level would have been incorrect for his placement, and that would have been an indicator that they needed to pull it out and not put any feeds in. But because she did not do those things, all day long he struggled with his feeds. All day long we proceeded to tell the staff that there were things that were going wrong with his behavior and his attitude, and that he didn't seem to be doing well. We were giving a lot of kind of platitudes that, well, we're weaning him off of oxygen because he's going to be going home soon, so that could be making him agitated, and the list would go on. And we found out, though, that his feeds being put directly into his lungs, causing him difficulty in breathing. And it was later that night that we watched our son die in front of our eyes as 20 medical staff tried to resuscitate him, to no avail. And so that has led me on my journey to make feeding tube placement and verification a safer practice, because still today, and that was 12 years ago, and still today, it's done blindly by the bedside, and a leap of faith that it's been put in correctly. And if medical staff use evidence-based practice, which is what the Novel Project has done studies and written papers on and provided videos showing what those gold standards are in the evidence-based practices today. And that's also what the Patient Safety Movement Foundation has also documented with their APS 15, which clearly outline what are the correct procedures in doing feeding tube placement and verification. And the bottom line is that they need to be verified with pH and, are we still there? Sorry about that, my phone went. But we found out that with the Novel and the apps that they are providing that information of gold standard and evidence-based practice so that people can do it by pH strip. And if they struggle with that, then they do it by x-ray. And just like his very first feeding tube had been done with by x-ray because they had struggled. And that should be the standard, that when there is struggling, they need to investigate why. Is there something that is, causing the anatomy not to allow that tube to go down easily? And so that started me on my quest to make sure that it's a safer practice for everybody, because NG tubes are put in multiple different types of patients, from infants to adults, and everybody is at risk when that is put in blindly at the bedside.
Deahna, when I listen to you, I'm reminded of how many people, including myself and obviously you, who've had an experience like this, and we become some of the most knowledgeable people about a procedure, even though it's not our profession. You probably know so much more about the feeding tube placement than most people do. And I think Donna Prosser recently wrote an article that I saw on LinkedIn, Deahna Visscher from Patient Safety Movement Foundation, and the headline was, for about 20 years, we've been studying the ways in which we can make healthcare delivery safer. Like, we do know a lot more today about how to ensure the safe delivery of medical care, and yet it's still not hardwired in, and we need to spend the next, hopefully not 20 years, hardwiring in what we actually know helps, and to take away some of that false confidence that is more based on what that nurse said. I mean, it's true, she probably had years and years of experience and maybe had not had a moment like that. And in fact, when we were on our walk around the park. I know you talk about that, so maybe what I'll do is just flash over to our walk in the park. And then before we would do that though, I'd like for you to tell, if you would please, the story about how you went back years later. You're working with a nurse. This is after really helping the hospital standardize their care around tube placement. What happened? Tell people about that moment where you saw your work, um, perhaps saving another child's life and another family's grief.
Definitely. So after Grant passed away, one of the things that my husband and I were adamant about is that we did not want anybody else to suffer that same fate. And so when the hospital that he passed away at implemented changes, we gave them our permission to use Grant's story as an example of why this change is needed and putting a face to understanding the need to make that change, because it was a big change for a lot of staff that had been doing those bedside placements using multiple patient and just ask for it and not doing pH testing or requesting an x-ray. And so because that was a big change in procedures at the hospital, we really wanted to make sure they understood. So fast forward, I'm now a part of the patient safety committee at the hospital my son has passed from. I have parent partnered with them to make sure that continued safety happens in multiple areas, not just NG tube. But we were rounding on a program that they initiated for targeting zero harm. And as we were rounding with the staff to find out how much they had learned about the program that was being rolled out, or if they had actually attended the class that they were rolling out, to, kind of gather some data on that. And as we were rounding and talking with a nurse, I discovered that one of the patients that she had was an infant who happened to be on a feeding tube. So of course, my senses are heightened, and I'm starting to ask the nurse some very leading questions where I'm drilling into wanting her to tell me what their procedure is for verifying placement. And so I keep asking very leading questions that direct her into finally telling me that they'd had a loss at the hospital where a child had died because a nurse put the feeding tube in wrong. And because of that, that is why they use the procedures that they have now, where they test with the pH, and if they struggle, they use the x-ray. And I looked at her and I told her, thank you for telling my story back to me. That was my son that you're talking about. And it just really reinforced that my advocacy is working and that Grant's legacy is living on, because he is continuing to save lives even after his death. And that they did hear his story, remember his story. And I have bumped into several different people who have told me that they have heard his story at other locations. Like I was touring a hospital and met an ER doc. And when the staff was introducing to me, and they said, this is Deahna Visscher and her son is Grant. And he looked at me and he said, I've seen your video. I know your story. I was at a conference in New York and watched your story. And it just really moved me to know that here I am in Colorado and Grant's story has made it to, conferences outside the States and has gone international, like where we met in England, and is furthering to save those lives.
I wish that every person who has dedicated as much time as you have to helping make a horrifying situation, keeping that from happening for other families. I wish everyone would have the experience of their efforts actually showing results, and having that level of education for others. Well, I'm going to flash us to the walk that Deahna and I had just a couple of weeks ago in her hometown, just as I was leaving Colorado for Oklahoma. And I know that there's a lot more that we talk about, Deahna, that I want people to hear. And thank you for taking the time today to make sure that we have a really good introduction. I think we did actually have that introduction, but there was so much wind, so I'm going to have to cut some of it out. But this is a much cleaner feed, and I really appreciate you taking time again to make sure that people are aware of feeding tube placement, as well as just the need for us to prioritize safe delivery of medical care for everyone. And here comes Deahna and I on our walk around the park. And I know that you'll be very interested in what more she has to say.
Safer while they're out there doing their jobs. Because I also tell the nursing students, I know that nurse did not walk into the hospital and say, I think I'm going to kill a baby today.
No, certainly
She
not.
walked into that hospital saying, I am going to be the best that I can be, help save lives, make babies healthy so they can go home to their families.
Yep.
Just tragically, this nurse made a mistake. And I will say it has, obviously set poorly with her, but she is still so traumatized from it that to this day, and it has been 12 years, she still is unable to meet with me to hear me tell her, I forgive her, and I know you did not set out to do harm. It was an accident. But she is still so traumatized that even the hospital reached out to her on my behalf to try to facilitate that meeting.
And there wasn't.
And she's retired now, but she can't. It's too much for her.
Yeah.
So things I have done is, I will speak to anyone who will listen. I've been invited to several different
Good morning.
hospital organizations and conferences to, share my safety story and, to promote change.
You're doing all of this while you also work full time, correct?
I do.
Yeah.
Yeah, I have my IT job that has nothing to do with the medical world, and I have 2 boys at home I'm raising. So anything that I'm doing is on my personal time. I take time off from work and use my vacation to travel and speak at different places that take time to commute to. Because when I speak to the nurses, that's a 90-minute drive, almost 2-hour drive north to one of the universities I speak at. When I went and toured a hospital in Colorado Springs, that was a 90-minute drive one way. And a couple times I've spoken at conferences, they have been out of state. So again, it's and a lot of times it's on my dime.
Yes.
There are not people paying me. I've been paid twice in my 10 years of patient safety advocacy to speak.
Yeah.
Otherwise, it is all my dime, my time, my passion.
What keeps you going?
Knowing that I am making a difference, and I would say the biggest thing, it's keeping my son's memory and legacy alive. I mean, he died when he was 11 days old. I have 11 days of memories with my child. And so, as a result,
Good morning.
being able to share his story and make change on his behalf keeps his legacy alive, and it also makes his death not in vain.
Yes.
That something can be learned from it to save other people so that other people are not living the same tragic story that I am.
Yeah.
And others like me have had to share. I also belong to a grief group in my neighborhood for moms who have lost children. And so, and that has, it's something that those of us that have lost someone to, who have lost a child or have lost a person to a safety event, we always say it's not a club you want to be a member of.
That's for sure.
But once you're a member of the club, only those in the club understand.
Yeah.
So with my patient safety advocacy work, it's working and collaborating also with others in that industry to promote change, because only we know what it's like to have lost someone, And then for my grief group, we're helping other moms know and be supported that we understand what you're going through, and we're here to help you navigate the process. The process being different for everyone, but our shared experiences can help you navigate your path.
Right. That direct experience means more than I think people really think about. I mean, and certainly it's why you get invited to speak at those medical facilities. You were just talking about going to a new medical facility,
Right.
and not just looking at the NG tubes, but also looking at safety in general.
Right.
And although it's great that there's interest there, and we certainly don't want to have everybody have a direct experience in order to get it, to do something about it, to help prevent it and prioritize safety in medicine. I do often wonder how to really support people in being attentive more frequently, and like, for example, when we go to conferences, the environment is a conference.
Yeah.
So your headspace is in a particular mode at a conference.
Very true.
And I've seen it very effective. You've done it. I've done it. We've done it together.
Yes, we have.
We've shown up at these conferences, and the conference organizers do a great job of placement of these stories, and they're very thoughtful about it. But I do wonder sometimes what other spaces need to be created that are not headspaces for conference mind,
Right.
but that are spaces for heart-centered listening. And both within the hospital, but like we've been walking around this park. I can imagine us sitting out there on the lawn with picnic blankets and
Right.
and listening to each other, smaller settings, but more frequently.
Oh, I think having retreats would be a great place because it facilitates a lot of conversation. I think also, like I said, and I've hit a lot of different avenues and trying to do that. I've done one-on-ones. I have done where, like I said, in my situation, I've gone to speak to students to prepare them for what they're going to be doing out in the workforce, and to be aware that there are going to be patient safety issues that are going to arise in their career, and that their job is to learn from it.
Yes.
And grow from it. That I remind them, you are human. You are going to make mistakes.
Right.
It's what you do with the mistake that will change your career and change how you handle things in your future, personal or career-wise.
And the lives of your patients.
Right.
Yep.
And smaller retreats where it's, and in a way, like the grief group is, we meet once a month, and it's kind of a small retreat group where we're having conversations about our losses and sharing information. Things like that, I think, can be done with patient safety, so that it is a non-professional, formal setting.
Yes.
That can allow those conversations to be organic and work together, to help and heal and promote change.
Yep.
So those are just some things.
I know that there's the Telluride model that Dr. Dave Mayer has created, and a number of people have really told me that is an really effective space. It sounds very much like what you're describing. And I think we need a whole lot more of those in order to be effective.
I think what they have done is amazing. I think there needs to be more like it. And I think more people that are on the layman side need to be invited.
Yep.
I know there's a lot more professionals from my understanding, that participate in that retreat,
I see.
which is good. It is needed. But I think there are multiple layers
Sure.
to that model that could be followed,
Yep.
so that we're getting, everything from the top down and the down to the top.
Yep.
Those that have experienced it. And, also, you don't have to have a tragic harm to be patient safety aware.
That's for sure.
One of the things I do is I have also friends and family and in groups have reminded people that, wherever you are, there are small bits of change. You go to the doctor's office, make sure they wash their hands before they are doing your exam. That's you taking control of your safety.
Yep. Just a couple of days ago, a dear friend who was just diagnosed with a very serious cancer diagnosis, and they came in to give her a procedure and put her wristband on, and it's the right medical record, wrong name.
Okay.
And she knows what to look for because I've been telling her for
Right.
years. And she's listened, to be fair.
Right.
It's not just what I say, but it's also how people want to listen.
Exactly.
And
heard you.
she had
took
heard
to
it.
heart,
Yep.
And she saved her own life.
And she very well could have, definitely saved herself some complications at the very minimum. So
I also sit on a patient safety committee at a hospital. And one of the things I have noticed in there is that when the staff is in that meeting, they have their business hat on.
Yes.
They're in that meeting thinking in the space of their job. I'm there, as an outsider, speaking as a layman to things I observe. And I have to say, there's been many times where it's caught me off guard at how surprised they are at an observation I have made from the layman's side. Because I look at them and I know these people have children.
Yes.
They have family members. They have been patients themselves. But in that space, because it kind of goes to what you were saying, when you're in a professional or a conference setting, you have a certain mindset.
Yep.
In this meeting, they have their job mindset, and they have forgotten sometimes what it's to think from the layman's side. I remember one story in particular. They were talking about hand hygiene and trying to get that promoted and or continue that promotion. It's always there, but just how can they change the way that they talk about it to freshen it up?
Yep.
Pun intended. But I made a comment where I was saying, I was talking about people who are of different cultures or different races that might be afraid to speak up, because they were talking about they were wanting the patient families to speak up to the staff if they came in and didn't wash their hands. And so I was mentioning that, I'm a very outspoken person. I would totally call you on it. But someone of a different culture,
Might not
religion,
Yep.
or racial background may be raised that is different, and you don't challenge authority.
Right.
And one of the staff kind of had an epiphany, and she said, you're absolutely right. How can I expect families to speak up about something they're not comfortable with if I myself, when my son was, she said he'd injured his arm, and they were at the doctor's office, and because of her position at the hospital, she was in a risk management role. She was kind of there as the mom, but also the awareness of her role at the hospital, that when someone came in and they didn't wash their hands, she hesitated to say something.
Sure. Yep.
And because in her mind, she was worried about how they would respond to someone from risk management calling them for not washing their hands. And but then she kind of had that epiphany of, it's my job to say something. I need to say something no matter what. And if I'm going to expect people who aren't even in this industry to say something, I need to be prepared to teach them how to have that conversation. Because if I am afraid to have it, how can I expect them to have it?
Right.
And it was just a
That's
complete
so,
epiphany for her.
wow.
And for me, it was like, I
Yes.
don't think it was such an odd question, or observation.
Right. But that comes from your mental model of feeling very comfortable speaking up and
Right.
saying what's true for you. And I do know that there are many, many people who just simply aren't comfortable with that. And I think that happens at the caregiving level also. We were talking earlier about the resistance isn't always at an administrative level.
No.
Sometimes it's just, this is how we do it, and I need to stay like I belong. I need to belong with my
Or I'm respecting
team.
the hierarchy.
I'm respecting hierarchy. Very much some of the things that we're seeing right now on the streets around the United States and the world around systemic racism and the way in which our good intentions to police and create community safety are backfiring because our loyalties get skewed.
Yeah.
And when our loyalties get skewed, we lose sight of the ultimate aim that we're there for. And that's what I feel like that epiphany, and I think a lot of people are having epiphanies right now, hopefully, around the whole world in a lot of different ways.
Very much so.
There's so much mirroring. I have one last question, if you'd be willing to keep going. And I think this interview will work well audio wise, but we may have to recreate it. We'll just see how that goes. And I'd love to maybe supplement it with some Zoom, if you wouldn't mind.
Not at all. I would be happy to do that.
Thank you.
I'll look better in it.
Yeah, we won't have our masks. Let's see if I can get back to my question. It was around this notion of mindset and the ways in which we don't have to wait for the retreats or those gatherings that are different. I think you know this about me, but I think a lot about just how a simple breath can change mind frame. Yeah. And I'm curious, you're in the hospitals a lot more than I am. What do you see happening from practitioners as well as patients and family members that are helping them shift their mindset in real time so that they can begin to be more focused on that ultimate aim of the partnership in care?
Well, so when I'm at the hospitals, I am there for the patient safety meeting. So I haven't really lately been there in a hospital, for my kids. Actually, I was recently. I decided to have gallbladder surgery during this pandemic.
Oh, whoa.
Yeah. And, so I will say.
And you've walked how many miles with me today? Go you.
So in the patient safety meeting, I think one of the ways that they do is they always start the meeting with a patient safety story to get the mindset into thinking about safety in any aspect of the hospital, whether it's in the cafeteria to the patient room. And I think that has helped them to, put their mind in that mindset.
Sure.
Recently with my own hospital experience during a pandemic. So March 22nd, I woke up with horrible pains, called my doctor at 2:00 in the morning and said,
"Oh, Deahna,
should I go to the hospital? Because there's this coronavirus thing. And I don't know if my tummy ache warrants that." And he said, based on your symptoms and the way your voice sounds in pain, he said, so he was listening to me and he was listening to how I was breathing and my tone and listening to my space, and comforted me and said, I think this supersedes the coronavirus pandemic and you should go to the ER and should get looked at. And then being there on the first day that they declared no family members can be with you in
Oh.
the hospital. So
Hubby was dropped at the door, or
hubby dropped me at the door, parked the car, came in to be with me, and he could see me over the reception desk, and they wouldn't let him come through. So I had to be in the headspace to calmly, as he was getting a little irrational, "That's my wife!" and,
and I know about being an engaged family member,
Right?
and by golly, I'm going to be there.
Exactly. And so, even though I was doubled over in pain, I had to say, "Hey, hun, we left our 9-year-old and 13-year-old sleeping in bed.
Maybe you could go home."
I said, "Why don't you go home and be with them so they don't wake up disconcerted to find we're not there?"
Sure.
And then I got to be put in a different wing than the COVID area. So I felt like I was in a room. I was in a room by myself. Felt like I was in a hallway by myself.
Mm.
And but the staff, even though there was this pandemic going on, they were very conscious of the pain I was in and trying to come, find out what the source of that pain was.
Mm-hmm.
The staff was very good at keeping me calm and managing my pain. And, then they were very good when they said, "You will be having gallbladder surgery today."
Oh, boy.
We will be removing it because it's very bad. And, but all of them, even though there was all this crazy chaos going around them, they were focused on my needs, my mental well-being, my physical well-being, to help me go through this alone because of no family members being allowed to be there. But I really appreciated that they were able to put themselves in the headspace they needed
Mm-hmm.
to take care of my needs while there was all this chaos going on in their hospital because it was at the height of the pandemic.
Yes.
And I'm not sure what they did to get themselves in that headspace, but whatever they were doing was working. I had a successful surgery. I've had no problems since. I have, done a lot of walking. Yesterday I did a 6-mile hike up in the mountains. Felt no issues that only, 2 months ago I had gallbladder surgery.
Goodness.
So,
That raises something for me with regard to that question of how do you get your headspace. That often professionals, and I know it's true, especially in hospitals and even especially in the EDs, that their norm is to segment and focus. And so the decompartmentalize, exactly. And so what occurs to me is that in part, what really just needs to happen is we just have to prioritize safety. We need to decompartmentalize safety.
Yes.
And then embed it underneath the foundation so that
and make it just inherent to breathing.
Yes, exactly.
Yeah.
Exactly.
Walking all the way back to how do you take that breath to patient safety?
How do you take the breath? And just, we need to back up and go, our intentions aren't panning out the way we need. They're not operationalized in our day-to-day.
Yeah.
Is there anything else that you'd like to make sure to say before we close this particular part of our interview?
I can't think of anything.
Thank you.
Thank you for the opportunity to share my insight.
Yeah, thank you for being willing. And thanks for a great walk.
Oh, you bet, yeah.
Well, I don't know if you count on charity miles. Dr. Dave Mayer's walk and the Patient Safety Movement Foundation has this app that you can get on your phone. And it's on my phone, and whenever I walk, it just automatically kind of, I hope it does. Sometimes it misses, so I don't count every mile.
I'll have to put that in because I have been trying to walk a 5K every day. So I can definitely contribute my walking to that.
You might as well make them useful. But sometimes I don't like to bring technology with me, so it kind of depends on whether you are okay with that.
I've been bringing it because I've been mapping my walk.
Yeah.
I didn't this time because I wasn't sure Well, plus also my thing talks to me and it says, you've done 1 mile in 30 minutes, or you've done 1 mile